Welcome to this webinar, which is investigating the barriers and enablers of children's fruit and vegetable consumption using a socio-ecological model. So we know that low fruit and vegetable intake among children is a problem in Australia. While we do have almost 2/3 of Western Australian children consuming adequate fruit, there's still about a third that are not. And particularly a problem is vegetables. So you can see here that only 8% of Western Australian children aged 9 to 15 years of age consumed adequate vegetables. So this is especially an area we need to support. We need to find out why they're not actually consuming enough and what can be done about it. We know that poor fruit and vegetable intake is one of the 10 highest risk factors contributing to global mortality or death. And we know that almost 2 million deaths worldwide are attributable to low fruit and vegetable consumption. So we know that it's a problem in terms of insufficient intake, but what are those key factors that are driving this issue? And that's where a socio-ecological model can come into play. So this is a model that's been around for quite a number of decades now and looks at the various levels of influence on a person and a particular health issue. And at the intrapersonal or individual level, these are the things like your own knowledge, your own attitudes or skills to help address an issue. And the interpersonal level are things like your social networks, your family, your friends, and how they influence you. And then at the organisational level, or institutional level, some people call it, that's organisations such as schools, workplaces, childcare centres, those sorts of settings that could have an influence on your behaviour. And the community level are things like, for example, how your community is set out with regards to, does it support healthy food access? Is there good availability in stores? Are there good connected pathways to help support people walk to food outlets? Are there different interactions in terms of partnerships between organisations focusing on a health issue in your community? And then finally, the public policy level are things like local, state, national policies that would support a particular health issue. So we conducted a study looking at these various levels of influence on children's fruit and vegetable intake. And at that individual level or intrapersonal level, we found things such as attitude, children's own nutrition knowledge and cooking skills, and their food preferences were key drivers to fruit and vegetable intake. So in terms of attitude, it was quite heavily linked to convenience. So if there was ready-to-eat fruit and veggies available, children were more likely or reportedly more likely to consume it. In terms of food literacy, children's understanding of how to prepare food, how to select food, those kinds of things were important. Some children, because they were learning lots of skills through settings like schools, they reportedly were able to teach their parents, so their own personal level of knowledge and skills was quite good. And then with regards to their food preferences, they were reported to consume fruit and veggies more or less without issues, really linked to that availability. But then some children's preference for junk food or unhealthy food did prevail. The quote there was from a school and youth worker. So they said, kids know about it, what's healthy and unhealthy, but people don't always practice what they preach. Some practical strategies to address this level of influence is incorporating convenient fruit and vegetables into school or community activities to really influence those individual drivers. Of course, this also has links to that organisational level. Delivering experiential programs that focus on fun. So children were reportedly respond better to ideas around fun rather than linked to their health as such. And then hiding vegetables within meals and using star charts for fussy eaters. and innovative methods, so apps, social media, those kinds of strategies to support that individual level consumption of fruit and vegetables. The interpersonal level influences were things like role modeling, household provision, parental attitude, household financial resources, storage facilities, and so forth. And a key finding here was with regards to role modeling. So it wasn't just their parents, it was family, friends, or influential others that were having an impact on children's fruit and vegetable intake. And the quote here from a health worker is, "It might be Uncle Stan or some other esteemed adult, the value of being introduced to foods you might not have at home." So that just shows in terms of how important it is for others in children's lives to have a role in influencing their fruit and vegetable intake. Some practical application here is integrating role modeling components into food literacy programs to really try to help facilitate the knowledge sharing between children and parents or other adults or carers, thinking beyond the family unit, so noting those significant others, harnessing the reverse role modeling, so the children teaching their parents and really capitalizing on that to enhance that family understanding of how to prepare different foods, and promoting specific action-based fruit and vegetable messages, because people want those real call to actions, those specific ideas and practical application. At the organisational level, there were some key themes that we found in our discussions with key informants, such as school governance, so changes to lunch ordering, in terms of the school setting being an environment where we could support fruit and vegetable intake. Formal social support programs, so schools reportedly making significant contribution to fruit and veg intake in terms of their different programs that they have available. Some provide some fruit for morning tea, for example. In terms of school nutrition education programs, Crunch and Sit, curriculum linkages that promote fruit and vegetables. And some schools were doing some things like paddock to plate and living classrooms where they were, as you can see by the quote there, taking their students to meet the farmer to really get a greater appreciation of where food comes from. And health service provision was a challenge because a lot of people had a lot of ground to cover in terms of where it might have been outside service providers. They've got a lot of work to do in terms of the delivery of health education programs. So it made it challenging to reach everyone to deliver a good depth of education and information around health promoting messages. In terms of a way to practically apply these kinds of topics, ensuring that school-based food literacy programs are curriculum linked and hands-on, so that experiential learning, adopting a health promoting schools approach, supporting schools that provide fruit and veggies, so really helping to facilitate the doing of that, because the school as a setting can be an ideal vehicle for promotion of fruit and vegetables, but also that provision of fruit and vegetables. And then trying to develop a common agenda among service providers that has a place-based focus. So consistent messaging around fruits and vegetables, key health messages, the way in which things are delivered, and that place-based focus in terms of what's relevant to that local town or community. The community level influences included things like availability in food outlets, community health promoting spaces, quality and promotion, and other things like price. So there was, in terms of this quote, there were other community settings that were ideal places to promote fruit and vegetables or even supply them. So an example was a local pool. So when children did a certain number of laps, swimming laps in their pool, they had fresh fruit as a little snack or a reward afterwards to help promote it, normalize the consumption of healthy food. So these kinds of places in the community could be ideal settings. Other things like community gardens were reported as good places for health education and provision of fruit and vegetables as well. In terms of practical applications, some strategies could be improving the convenience of fruit and veg in store. So people were talking about chopped up fruit and vegetables available for, picking up quickly and consuming quickly, health promoting spaces and health messaging. So really utilizing those community assets or community spaces to promote fruits and vegetables and also provide them where practical, and then empowering the community to advocate for healthy built food environments. So trying to advocate for these community locations to be good vehicles for promoting fruit and vegetable consumption and supporting it. At the public policy level, there was discussion amongst people that were part of this research saying that there was a need for improved food supply. So it was definitely inequitable across rural and remote Western Australia. There was different issues in different regions, but definitely a need for improvement. So looking at store policies in particular, this quote from a health worker was saying it would be great if there was a store policy because then more things could be regulated around access to food. Some people talked about the influence of a store policy being implemented and that it really did make a difference, a positive difference in terms of the types of foods, the cost of food, the quality of food that was available for people to consume. So some practical application would be trying to get capacity building and consensus building in the public health nutrition workforce to really help with messaging around or advocacy for store policies or store changes, working with industry to do that, of course, because it's something that's really important to do collaboratively. Monitoring of the food supply in terms of availability, affordability, quality, those sorts of markers to help us understand what's going on in different areas and regions, where are there issues that we need to work together to try to resolve, and then advocating for local priorities in public health plans that local governments are compiling. So what does all this mean? Well, we do need to harness strategies across levels of influence. So that socio-ecological model can be really useful to identify the kinds of topics or concepts or ways in which we could influence health behavior across those levels, because we know that each of those levels don't happen in isolation. So in terms of someone's ability to access and consume fruits and veggies, it's not only influenced by their own personal attitude, there's all these different factors at play at the same time. So if we can intervene at these different levels of influence, we have the greatest chance at positively impacting children's fruit and vegetable consumption. And a number of these factors do relate to food security because they are relating to food availability, access, use, and all of these different pillars of food security. So fruit and vegetable consumption is relating to that nutritious food element of food security. So it's really important that we do try to facilitate as many different ways as possible to help people achieve a healthy diet.